Yeah, the brief is something that we decided to put out from COPA because of what was taking place within the marketplace with specialty pharmacy and in-house pharmacies. Specialty pharmacies over the last decade have done a great job of being able to sell themselves to others on what they do well. Sadly, what has happened is the patients have been coming to the practice to be taken care of for the issues surrounding the oral drugs. And we in the practices have not done a good job of being able to show the world, basically, those people, the payers, state governments, PBMs, what is going on with what we do in being able to take care of our patients when it comes to oncology oral products. So what we did in the brief was we said we need to tell our story. We need to show what takes place within a cancer clinic when it comes to taking care of patients within our clinic. For example, our patients come in every day. We're very intimate with our patients. We know every detail about what takes place with that patient. We have the patient medical record. The patient is being seen regularly. And this is something that is not done in a specialty pharmacy. Specialty pharmacy does not have that patient medical record. They don't have the labs. They don't have all the scans and the MRIs, PET scans, everything that takes place with that patient. So what we have is we have that point of care that is so intimate that we're able to immediately access the drugs that that patient needs from an oral standpoint and be able to get that drug to that patient immediately. And we wanted to be able to tell that story, and in the paper we talk about the relationship we have with the patient and our ability to dispense that drug that that patient needs immediately and not do it from like what a lot of specialty pharmacies do by providing a 90-day supply, and that patient, because of the toxicity level associated with that drug, that patient has some issue, and 2 weeks later they're off of that drug and onto another drug. They're dose reduced. We end up adding another drug because of side effects related to that patient getting that drug, and there becomes a lot of waste, which happens in the specialty pharmacy market. And then sadly enough, that family brings those drugs into us and we could do nothing but throw those products away. And we're talking about thousands and thousands of dollars per patient of wasted drug. In the clinic, we might give a 15-day supply to see how that patient responds to that drug. And then if they respond well, then we give them a 30-day supply. But we never go beyond a 30-day supply in giving that to the patient. So we're very cognizant of waste. We're very cognizant of the side effects and the toxicity level of the drugs. We're also very cognizant about wanting to make sure that that patient gets the drug to begin with. And because of the cost of the drug, many patients have an issue with the cost associated with that drug. So we help those patients achieve patient assistance. We search every avenue on behalf of that patient in order to find some kind of patient assistance when there is a huge financial burden on that patient. We also fill out all the paperwork associated with getting that drug. There's a lot of administrative burden, and because we are so intimate with that patient and their care, we're able to fill that paperwork out and quickly, within usually either the same day or 24 hours, turn around and get that patient that drug. So the brief, in summary, was to tell the story of how we in community oncology, in-house physician dispensing pharmacies, distribute drugs to our patients in a timely and efficient, a very personal way to our patients so that they are getting the kind of care that they need versus what takes place in the specialty pharmacy setting.